founder of the Auth Method, and I'm here at Oakworks in New Freedom, Pennsylvania, and I'm going to demonstrate some forearm massage techniques in side lying position. This is my model, Josh, and today we're using the Oakworks side lying positioning system that is very comfortable, and as I learned today, is also made in America. So some of the benefits to using side lying position are the whole shoulder girdle is available to you. So I can work on the front of Josh's shoulder, the back, the top, or the lower shoulder through here. And this is very beneficial for a lot of reasons. If somebody comes in and they're in pain, this is going to help me figure out what's tight and what I need to work on. So it's great for diagnosis and treatment. It's also nice because I can just look at Josh's shoulder and see what the alignment is like in his shoulder, which is pretty good. But as we all know, a lot of our clients are rounded forward like this. So side lying position allows us to work both the front and the back of the shoulder to correct some of those misalignments. I'm going to be using my forearms today because the forearms are more durable than using your hands. So it allows me, and hopefully you, to treat more clients and work longer. I'm going to start with the front of the shoulder, the chest, right through here. So taking my upper forearm right to the front of the shoulder, I'm going to take my passive hand just behind the shoulder, and I'm going to glide towards Josh's sternum. And I'm gliding just below the clavicle, so I'm gliding right along the posterior border of the clavicle all the way to the sternum. And it's a nice broad stroke. And I'm using my passive hand just to pull the shoulder down slightly, giving a little bit of stretch to this area. I'll show you a deeper stretch in just a moment. And that's also another one of the benefits of side lying position, is that it opens up a lot of angles to do stretching. So in this position, if I was working his rhomboids, I could take the shoulder forward to stretch the rhomboids. But since we're working the chest, I'm going to pull the shoulder back just a little bit more so that I can work deeper through here. Now I'm going to change my angle just slightly, working a little bit lower so that I can get the pec minor. Now mind you, this is a little more sensitive of an area on most clients, so take your time to just slowly sink into that first layer of tight tissue. And I'm sitting on the table, so I'm very comfortable. Another one of the advantages of side lying position is that you can sit up nice and straight. There's no rounding through the back. It's very easy on the body mechanics. Side lying position is also a more comfortable position for most clients. A lot of clients complain about lying face down with their face in the face cradle or getting clogged through the sinuses from lying face down. Side lying position is more like a fetal position. It's very comfortable for your client. And so I can work quite deeply on Josh with very little effort just from using this position. And again, if I need to go deeper, I can just pull that shoulder back and give a little bit of a stretch while I do this stroke. And again, this is very deep, but taking very little effort. I recommend receiving this, doing a trade with somebody and receiving this so you can see how it feels. Okay, so I don't need to change my position. I'm just going to stay seated just behind his head, and I'm going to switch to work the medial deltoid, so right along the top of the deltoid. So I'm taking my upper forearm just to the top of the medial deltoid, and I'm going to glide down. Now he's pretty broad, so I've had to stand up into my standing leg so I can get a little bit higher here. And as I reach the end of the deltoid, I'm going to lift up and begin my stroke again. And now I'm going to ask Josh to do a movement that's going to intensify this stroke. So Josh, reach down through your fingertips. Great. And bring it down just a little bit. Good. And then lift it up about an inch. Good. And that's just activating his medial deltoid, and lower it. Good. And lift up. So that little bit of activation through the muscle fibers is going to intensify the stroke. And just relax your arm. Good. And let's do that one more time. Reach down and lift up. Good. And down and lift up. Good. And down. So one of the nice things about side lying position is it makes the muscles along the side of the body more available to work on. So next we're going to do the top of the shoulder along the side of the neck to the occiput. I find a lot of clients build up tension through the tops of the shoulders, and they're hard to access in prone position without using the thumbs or contorting your own body to get in there. This is a really easy way to work the top of the shoulders. It's very easy on your body and very comfortable for your client. So I'm going to angle my forearm out, but I could angle it either way actually. If I needed a little more leverage, I could angle it in. I'm going to take my passive hand to the top of the shoulder, and I'm just going to glide right along the top of the shoulder with my forearm, just like so. So I'm pushing down slightly on his shoulder to get a little stretch through these upper traps. And I could even have Josh reach down through your fingertips towards your feet. Good, and that's just going to give a little bit more stretch. And relax. Good. And reach down. And relax. Good. And then to continue this stroke up the side of the neck, angle the arm out. So my hand is higher than my elbow, so my arm is slightly angled up. And I can glide right along the transverse processes of the cervical spine up to the occiput. Now I don't have a lot of leverage in this position, but I don't need a lot of leverage. These muscles along the side of the neck are so small in comparison. And my shoulders right over my elbow. So I can just lean into this, drop a little bit of body weight down as I need to. And again, the side of the neck can get quite tight, and this can be an area that's hard to work on in supine or prone position without using your thumbs. Good, and just breathe. So you want to stay posterior as you do this stroke. If I angled my arm downward or moved too far anterior, that would not be comfortable. Okay, so this is a taste of the shoulder routine in side lying position. The full routine is on my DVD, A Guide to Using Side Lying Position. Thank you so much.